Good morning, students. Today, here we will discuss the topic medication chart review, clinical review, and pharmacist intervention. First of all, what is medication chart review? It is a fundamental responsibility of a pharmacist to ensure the appropriateness of medication orders. Means the drugs which has been prescribed to the patients, whether they are proper or not, whether they are correct or not, that we need to be ensured. It serves as starting point for other clinical pharmacy activities. For example, medication counseling means when the pharmacists are doing counseling to the patients, when they are telling them regarding the medication, regarding the drugs, how they have to take the drugs, in what time, in by which way. So that's all comes under the medication counseling. And TDM, therapeutic drug monitoring, how the drug is going to be monitored, how the pharmacists are in touch with the patients and they are checking all the ifs and buts of the medication, whether the therapy is going in right direction or not. So they are always ensuring that drug interaction, if any drug interaction occurs during that therapy, so it can be checked. And ADR, adverse drug reactions. So ADR also going to be reported if it occurs during the medications. Organizing information according to medical problems, for example disease, helps break down a complex situation into its individual parts. So we must develop the therapy according to the medical problem. Means we must have the exact drug, exact list of drugs. That's why we are discussing a medication chart review. So whatever drugs which are available us, that we should not give directly to the patients. The disease, the disease and the drugs which require for that disease, the drugs which seeks to that disease, fixed to that disease, that drugs we should keep in our chart, and that chart is need to be reviewed constantly, and that drugs need to be included into your chart. And that's why the drugs which will be required specifically for that exact disease, exact that problem, that drug only we should include into our chart and we should give to that typical patients. Goals, now we will discuss here the goals of this medication chart review. To optimize the patient drug therapy, means if you have prepared a good chart for the typical disease or typical conditions, and more effective drugs if you will add into our chart, means it will definitely optimize the patient drug therapy. To prevent the minimize drug related problems and medication errors, because what we will do, we will select the drugs which are having less side effects, less toxic effects, and which are having more efficacy. And accordingly what we are doing, we are minimizing the chances of medication errors or drug interactions or adverse drug reactions. So in this fashion, they are the having two goals. Now we will go for the procedure. The patient's medical record should be reviewed in conjunction with the medication administration record. Means here the patient's medical record means what are the what are the medication history, what are the medical history or physical history, or what are the various pathological reports the patient is having, what are the physical status, if any disease, if any complication, if any typical allergens or anything, what are the consequences of medical record the patient is having regarding his body weight, his RBC count, his what you can say lipid profile or respiratory rate, any sort of whatever medical examination the patients have undergone, that all the information is nothing but the medical record of that patients, and we should comply that medical record of patients and the medication administered record. Means whatever the drugs which we are administering to the patients during the therapy, that is nothing but the medication administration record. So it should match, it should tally, it should comply at what was the conditions. For that condition, suppose I will discuss here that if the patient is having the allergy for cephalosporin, for example cipixin, he may have direct like condition if he will take that, and this is the medical record. Means that patient is having allergy is a medical record. And here administration, if in our administration list if you are having any drug like cipixim, so what will happen, it will produce the direct like condition, it will produce the allergic. That's why if you are checking his medical record, we will not include that drug into our administration record. We will try to remove that drug, or we'll try to replace that drug by another safe drug which won't produce any toxic effect or any allergic conditions into the patients. In this fashion, we have to go with these points. Now, recent consultations means recently if any consultation has been done with the patients, if patient was complaining regarding any complication or if any problem or if any new problem or new complication he have come across, or treatment plans, or what is the therapy or treatment plans, procedure of therapy, and daily progress if any progress occurs into the disease or that difficult comorbidity, so we have to check their daily progress should taken into account medication order and each patient's care. So during the medication orders and planning each patient's care, we should consider all these three things: recent consultation, treatment plans, and daily progress. Accordingly, we should give the next drug, or accordingly we should plan their patient care. All current and recent medication orders should be reviewed, because the recent medication what you are doing, accordingly the next consequences will occur. So that's why you should always check the new medication. Components of medication order review. So these are the components of medication order review, and this is also included into our pharmacist intervention. So they are the components of medication order review. How we will do the review of medication order? This medication order is required for preparation of our medication chart. So here, if you will review the order, after you will prepare the chart. Now here, first point is checking that medication order is written in accordance with the legal and local requirements. So whatever list of drugs we'll prepare, that it should be legal one. Means we should not go for the drug like morphine or heroin or codeine. So drugs which have been banned already, or LSD or ketamine, because these drugs are any steroid which we are taking for uh, development of muscles, so they are illegal drugs. So there should be no any illegal drugs. So drugs should be legal. And local requirements, the drugs which we require for the local community for which we are prescribing the drugs. So which drugs are more suitable for this local community, that we should think. Ensuring that medication order is comprehensible and um, unbiased. What is comprehensible and unbiased? Comprehensible means no, it is for sure. Comprehensible by all the aspects. We are coming to the conclusion that this is the perfect one, comprehensible. And unbiased means clear, very straight, very clear. That appropriate terminology is used. That drug name are not abbreviated. Means sometimes we are writing in the short form. We are having habit to write the drugs in the short form, which we cannot do. We are not supposed to do. At any cost, we cannot do that. So drugs should not be abbreviated, or drug should not be in a wrong spelling, or in a dirty handwriting. So that we should try to avoid. That's why it should be clear. Ambiguous means it should be very clear, and it should be uh, perfect. Whatever drugs we are writing, it should be comprehensible, means it should be perfect drugs by checking all the aspects, and annotate the chart to provide clarification as required. Annotate means to give the supplementary notes. Annotate to give the supplementary notes for the chart to provide clarification that why we have prescribed that drugs, what that drugs contains, for which disease, or by which action we are using that drug. So annotate, give the additional notes, additional points to clarify that drug. Next is editing order for medication to which the patient may be hypertensive or intolerance. Detection parameter should be there, not only for hypertension but also for intolerance, or for any allergens, or in angina like condition, or if patient is having asthmatic conditions. So for number of cases, so we should detect that condition, and accordingly we should go for that medications, ensuring that medication order is appropriate with respect to. So whenever we are placing the order for the chart for the new purchasing of the drugs, so we should discuss these things. So for appropriate, for the proper order of medications with respect to, now there are 4 points that we will discuss here. With respect to the patient's previous medication order, means patient's history, what drug patient have taken in last time. According to that we should decide the next order. Next is patient's specific consideration, for example disease states. If patient is having any disease states, for example he is having asthma, or he is having phobia, or he is having condition like anorexia, or he is having problem of anemia. So any disease, or liver problem, renal failure occurred, or HOT or HBT level is down. So accordingly, or hypersensitivity, or hypertoxicity, or hypothyroidism. So accordingly, what is the disease state, or very low weight, or he is having the high blood pressure, or sugar level is high, or very low sugar level. So that decides. So disease state, according to disease state, we have to define the drug. And also in case of pregnancy, in pregnancy we have to go for very less drug, because the area is very narrow, because very less drug are safe for the pregnant woman. So that's why here also, by specific conditions of the patients, we will define the drug, we will decide the plan for that specific condition and pregnancy of the patients. Drug, and with respect to drug dosage schedules, especially with respect to age, means here we are deciding the drug by considering the dose and dosage schedule with respect to age. If patient is very old age, above 60 years or 65, so accordingly what dose is better for that, which dose is fixed or suitable for that dose or dosage form, that we can decide. And also for renal function, if any renal failure has been occurred to that patients, so in that condition also what dose and dosage form is suitable, that we will decide. And also in case of liver function, if any liver damage occurs, liver fibrosis occurs, so in that condition we should not give the drug which will worsen that liver function. or which will kill the liver. We should give the drugs which will protect the liver as well as protect the renal, means kidney. So in these fashions, by considering all these things into our mind, we will decide the drug and their dose as well as dosage form. Next is route, dosage form and method of administrations. These things are also important when we are considering any drug. So by which route we are giving that drug and which dosage form we will decide, and method of administration, how we will administer that drug. By keeping these things, we will decide the appropriate drug for the medication order. Next point is checking complete drug profile for medication duplication, interaction, or incompatibilities. We should check twice, thrice for the drug profile for medication duplication. The drug should not be duplicate, and also their interactions and incompatibilities, means to which the drug is the patient is incompatible. That also we have to find out, and we should not go for that drug. Ensuring that administration times are appropriate, that is with respect to food, other drugs and procedures. Now here, when we are giving order for any drug, so we should ensure that the drug is taken has been given at the morning. So because suppose if you do give the drug like diazepam or lorazepam, if you are giving that drug at daytime, what will happen? Person will face drowsiness, sleep will occur, and if person is driving or working with heavy work, heavy machineries, so accident will occur. So that's why the proper time is also very important. And also with respect to food, suppose if any drug is has been banned with the milk, or if some drugs are uh, advised to take with milk, or you should take empty stomach, and if you are taking without food, or if you are not taking empty stomach, so that creates some problems, or other drugs and procedures. So there are lots of drugs that you have to take with their typical indications, that certain drugs should not take with another drug, it will produce the drug interactions. So for avoiding that also, we should take the drug properly. Checking the medications administration record to ensure that all orders have been administered. So we should check the medication administration record to ensure that all the order has been administered or not. If they are not administered, if some drugs are spare there, so we should not give their order again. If all drugs has been administered, means the drug which is required and it is not available, then and then we should go for the placing of order. Ensure that the drug administration order clearly indicates the time at which drug administration is to commence. This is very, very important. Recently, I told you we should ensure that what is the time of drug administration and at which time we are taking. If drug is specified for morning at 9 o'clock, you must take it at 9 o'clock. If drug is designed to take after the lunch, you should take after the meal or after the lunch. You should not take after, you should not take before lunch, or you should not take empty stomach. So according to the time, if drug is designed to take at night at sleeping time, so you must take it at night when you are at the bed. So timing is very, very important. Next point is special consideration should be given. Just what I am checking. Okay. Special consideration should be given, especially in short course therapy or in antibiotic analgesics, because some antibiotics are very dangerous. For example, tetracycline or chloramphenicol or macrolides antibiotics. So in that condition, we should have the special attention toward the patients. We should take very cautiously those drugs, because those drugs are producing the adverse drug reactions. And also in some analgesics, because COX-2 inhibitors like cephalocoxib or ripicoxib, so these drugs was banned into the market for their problem into the heart. So they are producing the angina, they are enhancing angina. So that's why they are able to produce the cardiac arrest. So that's why this drugs has been banned. So analgesic also sometimes they may produce toxic effects. Next is ensuring that the order is cancelled in all sections of medications administration record when the drug therapy is intended to cease. So we must ensure that the order is cancelled or not. Means if your therapy is ceased, if your drug therapy means whatever drugs you are taking for your treatment, if therapy is completed, so we should cancel your order. We should not go for that drug. If that drug is again required for another patient, in that case only you can reorder, you can place the order again. Otherwise you should ensure, if therapy has been ceased means therapy has been stopped, you should not go for that, because unnecessarily it will produce the burden on your capitals, because you should work very precisely. Next point is, if appropriate, follow up of any non-formulary drug orders, recommended a formulary equivalent if required. So if any non-formulary drugs means the drug which is not in the list of the formulary, if that drug is required, so we should do the follow-up of that drug, because that drug may produce any adverse effects or side effects. So in that case we should, because we are taking the risk, and when you are taking the risk, that is our responsibility to go with that patients to check out always, and to ensure that whether that drug is producing any adverse effects or not, or whether that producing the expected results or not, that we should always ensure completely. Then and then we should go for the therapy. Next is ensuring appropriate therapy monitoring is implemented. So here appropriate therapy monitoring is required. Means we should check that patient is getting proper results or not. Means is there any progress into the health of that patient or not, that you should check. Means our therapy is working or not, our treatment is going in right direction or not. If it is not going in the right direction, in that case we can change our drugs for better results. Next is ensuring that all the necessary medication is ordered. For example, pre-medication and prophylaxis. So we should ensure that whatever drugs which we required along with the pre-medication or prophylaxis, so that all the drugs we should place the orders. Next is reviewing medication for cost effectiveness. It is also another way of pharmacoeconomics. We should also review the drugs, that we should not go for the drug for only brands, but we should also check that if any better alternative, better cheap drug is available for the same drug, same molecule. So we should also go with that, because what we want the results. We don't want any brand, because for results, if you are having good drug and if it is having less cost, so why don't you choose that drug? You should choose that drug also. Next is identification of drug related problems. In that, first is untreated indications. If during therapy, if any indication has been remained, if any symptom has been remained, so for that also you should consider the drugs. So suppose after a treatment, if on your skin, if any lesion has been remained, if any dark spot, if any rashes has been remained, so what we will do, you will again add some drugs to remove that bad patches or dark spots on your skin. At additional drugs you will purchase order. It is only example. Like that, if any untreated indication has been remained, for that which drugs we will plan, that we will decide here. Next is inappropriate drug selections. So when we are having inappropriate drug selections, when you are not going to do proper diagnosis, that may happen. So that's why if you are diagnosed properly, you must go for the proper drug, appropriate drugs. So next problem is adverse drug reactions. This is also another problem which may occur when you are not checking the patient's allergy, patient's medical history, what his body status, physical status. If you will discuss that with the pharmacist, that drugs and the patient history, if you will match properly, then we should go for the therapy. Otherwise, it will produce the adverse drug reactions. Next medical problem is failure to receive the drugs. Yes, it is also one of the critical issues may occur. That's why there are lots of companies. They are in the medical coding insurance facility they are providing. So in that, one person is always doing phone call to the patients for their drug adherence. Suppose if patient would take the drug at in the morning 8 o'clock, the person who is in touch with you, he will call you at 7:45, means 10 minutes before, 15 minutes before, to tell them, to remind the patient that you have to take the drug at 8 o'clock. By which what will happen? No drug failure will occur, and the patient will take the drug at proper time without skipping any dose, because skipping also one of the critical issue. So here also failure of receive drugs can be solved if you will appoint any person like that. Next is drug interactions. It is also one of the issue. Drug interaction will occur when you are giving the multiple drugs without considering their drug interaction with each other. So they will produce the drug interactions. Next is drug use without indications. If any drug has been advised or implied that you should take this drug empty stomach, so don't take with food. If drug is advised that you should take that drug in the morning, so don't take at night. So proper indication, you should take that drug. Next is overdose. Overdose is also one of the issue, because what will happen if you have taken that drug and you will feel forget that I have taken that drug, so overdose will occur. This happens mostly into the psychological disease patients who are having the depression or psychosis, schizophrenia, or post traumatic stress disorder, or OCD, obsessive compulsive disorder. So in those patients, these patients are having habit of forgetfulness also, and due to which also they are taking the more drug. Or in case of forgetfulness, if you forgot the drug, and in the night if you are taking the two doses of the drug, but you will think that if I have missed the drug in the morning, so why don't I take that drug in the night, so due to which it will get converted into the overdose. So it is also one of the issue which will produce. Next is medication chart endorsements. Another important goal of treatment chart review is to minimize the risk of medication errors that might occur at level of prescribing and or drug administrations. Because prescribing is very important. By considering the patient's history and patient's health status, when you are prescribing the drug correctly, no medication error will occur. And next is drug administrations. And when drug is the patient is completely follow the instruction of the physician that how to take that drug. So it will also avoid the drug administration error. Next is a medication error is any preventable error that may lead inappropriate medication use or patient's harm. So always the patient harm will occur if you won't drug at proper way, at proper time, and by proper route. Suppose that tablet has been told that swallow the tablet, and if you are chewing tablets, if the it has been prescribed that you have to chew tablets, and if you are swallowing the tablets, because if you will crush tablet into your mouth, it will dissolve into your saliva, and you will get its effects into your start beginning from your mouth. It will absorb from your buccal cavity, and if you swallow it, it will directly go into your stomach and will be destroyed. Means you won't get any effects. That's why you should take the proper medication by proper way. So here medication error will occur if you won't get that drug by proper advice of your physician. To prevent potential morbidity and mortality associated with those errors, pharmacists should systematically review the medication chart and write annotations on the chart where the medication orders are unclear. So there is role of pharmacist who can review the medication chart, and he will write down some notes there, any supplemental documents or any sentence he will write that this drug is having the side effect, and due to which patient was complaining regarding the headache, or patient was having the problem of depression by taking these drugs. So in this fashion he can clear that by writing there that it will produce the problem, and we should try to avoid the drug. Now next is clinical review. Clinical review is one of the integral component of the medication review and should preferably be performed on a daily basis. It is the review of patient's progress for the purpose of assessing the therapeutic income. Clinical review means whatever drugs the patient is taking. So accordingly, whether we are getting its therapeutic outcome or not, whether the patient is coming out from the disease or not, that we are ensuring. The therapeutic goal for the specific disease should be clearly identified before the review. Means after giving the whole treatment, we should analyze, we should check the patient that whether the patient is any consequences or any symptom has been remained or not. If patient is completely free from the disease, and also after the therapy, if the therapy whatever you have received, that therapy did not produce any another complications, that we should review, we should check. It is not nothing but the clinical review. Now here we will discuss the goals of the clinical review. That first is primary aims of the clinical review are to assess the response of drug treatments. What was the response? That's why the physicians are always called as medical practitioners. They are practicing. So here we are checking. That's why we are asking patients to come on next day after taking this therapy. Means if 3 doses has been prescribed today, so I will tell the patient to come tomorrow to check out its effects. So to check the response, whether the drug is decreasing that disease problem or the drug is producing another problem. It is also called as physicians induced disease. So for checking them, we are checking the response of that drug by asking the patients to come after next day or after 2 3 days. Next is evaluate the safety the treatment regimen. Same, after giving the drugs, you should ask patient to come on next day, and you will ask the patient that whether you was having any complication due to this drug or not. Means if there is any pain into the micturition in urination, if any pain occurs after taking the drug, or if increase in temperature occurs, or sneezing or discongestion, or blood pressure will increase or decrease, so that we should check. You should ensure that the drug is safe. If drug is safe, then you should continue your therapy. Assess the progress of disease and need for any change in the therapy. Yes, if the progress is occurring into your disease conditions, suppose if you are having the typhoid, and suppose by giving these drugs, if it will decrease the symptoms like fever has been disappeared, or whatever your WBC count has been increased, it will come to the decline. So like that, if you are having good health status, if you are getting any progress into your status, means your therapy is going in right direction, means there is no change to do into your therapy, means you are getting the correct medication. If it is not working, if your body not responding properly, if no progress occurred, in that case we have to change the therapy, we have to change the antibiotic, we have to change the typical drug. Next is to assess the need for monitoring. So you should assess if your monitoring criteria is not proper, so you should assess, you should analyze your criteria, and you should change it if any problem is there. If it is going in good direction, so don't change your criteria. Assess the convenience of the therapy to improve the compliance, means you should go for the better alternative. Suppose if patient is complaining regarding your medication that, sir, I am having problem, I am having pain during that injection, or I am having the irritation during that tablet or during that therapy, so for that you should go for the better alternative which is having less pain or no pain, or it is palatable to the patients. It will improve the drug compliance, means it will expected and accepted by the patients, means patient will feel free, patient will feel good to take that drug. Understood? So in this fashion we have discussed the convenience of therapy also, means it can modify the therapy at any time according to the patients, because we are working here for the patients, that is our basic goal. So students, here we have discussed the clinical view as well as the medication chart review and the intervention, pharmacist intervention. So in this fashion we have discussed this point. I hope you understood. So thanks a lot for hearing me. Here we will stop. So goodbye for today. Have a nice day.